The Global Surgery Lab presents Pelvic Packing. The goals of this video are to identify indications for pelvic packing, demonstrate an approach to pelvic packing, and outline the key steps of post-operative management. The goal of this procedure is to control hemorrhage from the pelvis. The main indication for pelvic packing is ongoing hemodynamic instability despite initial stabilization of a pelvic fracture with a pelvic binder. The general approach to extraperitoneal pelvic packing includes creating a fan and steel incision or a vertical incision from the pubic symphysis to umbilicus, opening the midline fascia, palpating the pelvic brim, inserting lap sponges into the pelvis, and creating temporary fascia closure. To perform this procedure, you will need a knife, lap sponges, ringed forceps, absorbable sutures, and sutures or staples. Remember to follow all safety protocols and best practices. To begin, place the patient in supine position and create an 8 cm vertical incision from the pubic symphysis to the umbilicus. Note that a fan and steel incision could be used instead. Next, open the midline fascia, ensuring that you do not open the peritoneum. Next, remove any clots from the pre-vesical space and retract the bladder to one side, then palpate the pelvic brim. Next, use rolled lap sponges to pack the pelvis. Use ringed forceps to push the first sponge down to the sacrum. Note that this is not shown in the video. Continue to insert rolled lap sponges into the pelvis until you create a good pressure on both sides of the retroperitoneal region. Note that sometimes up to 9 sponges may be necessary. While you are packing the pelvis, leave the strings of each rolled sponge outside the incision. There will be approximately 3 per side. You may tie the strings together or use a stitch to tie the strings together for easy removal. It is important to note that packing the pelvis without exploring the abdomen may result in the oversight of significant intra-abdominal injuries. Finally, close the fascia with an absorbable suture. Then, close the skin incision with staples or sutures. The sponges should be removed 24 to 48 hours after the initial pelvic packing in order to avoid sepsis. Once the packing has been removed, perform the final fascia closure using absorbable sutures and complete the skin closure. In conclusion, pelvic packing can be used to control hemorrhage of the pelvis.